Well, thank you very much. On our side, maybe the first thing that we want to do is to thank the minister for her visit, but also more importantly, to thank the teachers for coming in their thousands for vaccination. We are happy that young and old, and we also targeted, especially Minister, teachers in the primary schools. Because in line with your announcement that we can't continue with the learning loss amongst the primary school learners. So majority of the numbers that have been vaccinated now, of the 12,000 are primary school teachers. And then as we said that we had 5 districts, all of them are vaccinating. It's very exciting to know that in Motheo here, we started with the biggest districts. We started with Mangaung, where we vaccinated quite a number of big numbers. We are now in Botshabelo, and then we have done Tabanchu, and all the small ones will be concluded very soon. So we are very, very excited about that, and we really want to thank the Department of Health, because our partnership with the Department of Health is not only around the vaccines, but it also includes school health programs, because the Department of Health has been giving us the support. So I think that in terms of the numbers, the MEC of Health has actually covered us, but we just wanted to say thank you very much for enthusiasm and the excitement shown by our teachers. I believe that going forward, we will reach a stage where we will reach a normal, where learners can come to school every day and not once a week. Thank you.
Thank you very much, MC. So at this stage, we hand over to the minister to read the statement.
I hope these things can reach. Now, let me thank the members of the media, in particular, thank my colleagues, the MEC for Health, MEC for Education, but also head of department, the director, and senior leadership of the province. So I really want to thank you very much also to the media for really coming to cover us and spread our information. As both MECs have indicated, this is part of our program as the sector to make sure that we vaccinate as many people as possible who are in the sector. And I was very happy to hear from both MECs of Health and Education that they say, by Friday, they will be done. What will be remaining in the remaining days of our program is mop up. And I did say to the MEC that I'm not surprised. When matric results come, paid, they are paid. And so it's one province that works very well, and I'm very happy. I visited the site here. You can see also that there's movement, because during the teaching days, we wanted the process to move quickly so that no school stays here for more than an hour, so that they are able to go back to school. And I can see here the queues are moving quickly. There's additional health facilities. I assessed my blood pressure, so which is very good. To really have those support mechanisms. There's a doctor who is here all the time to make sure that indeed if there are any difficulties. But I was told that it's minor glitches. Small headache there, perhaps a sore arm. Injection. So, but they are saying there are no major difficulties, and I'm very happy about it. But I thought that now that I'm here, I might as well as really elaborate on the president's announcement yesterday so that we clarify the public. That's why I'm very grateful that members of the media are here. Because if you recall, the president yesterday announced that as a sector, schools will close from Wednesday with the final day being Friday. And that means that by Wednesday, learners, that's the last day for learners to be in schools. So teaching will stop on Wednesday. Then we use Thursday and Friday for teachers and managers to close the schools properly. So managers, educators will come to school until Friday and use Thursday and Friday to mop up and to really have an orderly closure of schools. And we had to do that because you will be aware that in some of our schools, some of the learners come from different provinces. So we can't tell a parent overnight who stays in Gauteng to say, come and pick up your child now. Parents have to make arrangements to come and pick up their children. And that's why we needed just these 2 days to really prepare to have an orderly closure, and we're very grateful that Cabinet agrees to that. So the announcement from our side is that learners in public and independent schools and private schools should be released for their winter vacation on Wednesday, the 30th of June. So the 30th is the last teaching day. And that we agreed this month because after the president announced, we convened a Council of Educators meeting at 7. So I held it on my way here at 7, with the meeting from 7 to 9, and this is what we confirmed. We then also agreed and confirmed that school management teams, teachers, learners in hostel facilities, and learners with special education needs waiting for parents to pick them up should report the latest by Friday. So if you have a child perhaps who is somewhere in the Western Cape at a special school, please make arrangements that the latest, if not by Wednesday, the latest Friday, 12:30, there should be no learner in our hostels in any of our facilities. But preferably, all learners should be out of the school premises by 12. Public schools, because we're closing now a week earlier, we're gazetted because we have to do it by law, will come back from the winter vacations on the 19th of July. So that's what we're gazetting today. That's what is going to be the law. That rather than coming back on the 26th, we're going to come back on the 19th. Schools we also have an arrangement that the necessary arrangements must be made to provide feeding to those learners who are beneficiaries of the National School Nutrition Program. So which means next week, which was supposed to be school days, schools must make arrangements that for the remaining 3 days, for Thursday, Friday, and the remaining 3 days, the school nutrition that kids get. We also agreed as CM that the usual winter vacation learner support programs, which we normally have for 11s and 12s, which are normally organized by province and districts, should continue under very strict conditions of compliance with the COVID-19 health and safety protocols. So we know what the protocols are. There should be more than 50 people, there should be ventilation, there should be spacing and other things. And what I wanted to also emphasize, MEC, unfortunately, some of these camps are residential camps. So we're requesting provinces to cancel all residential camps. So if there's a residential camp, let's not have a residential camp because it can be a super spreader. There are learners who are writing now the supplementary exams, now in May and June. And because there are very few, they normally will not even exceed 50 per room. We'll continue because they're finishing quite soon. So the supplementary exams continue and the marking of supplementary exams will continue. On the vaccination program, the vaccination program must continue. So the announcement that schools close on Friday doesn't mean our vaccination program stops on Friday. Teachers should come as scheduled. If in the Free State they're finished on Friday, good luck. But other provinces, every single one said they can't finish on Friday. So other schools are coming on Monday next week, Tuesday next week, and we're saying those that were scheduled to come next week should come. Because we don't want to continue vaccination next term we want to be done with vaccination by Wednesday next week. So vaccination programs will continue. And these matters that I'm relating to you, we had a meeting today at 7 o'clock with CEM. The DG has met heads of departments from the HEADCOM. We are linking up with the teacher unions who are represented in the ELRC, which is SANTU, NAPTOSA, NATU, and PEU. We also are consulting with FTB so that there's clarity as to what we're saying about the closure of schools. We're also speaking to representatives of private schools, which is NAISA, and the Association of Independent and Private Schools. And as a sector, we remain very vigilant in monitoring the developments of the epidemiology in our sector, working close with the Department of Health, and we're very grateful to MEC for all the support. My colleague tells me, if it was not of your support and your team, we will not be confidently saying by Friday, Free State will be done. It's because of the support that we're getting from you. And CM in the morning, we also got statistics that in 3 days' time, we had vaccinated more than 200,000. I was very delighted that KZN had done 60,000 alone. 60,000. And all the other provinces, the MEC has said that they'll be done. When they get their batches, they'll be done. So I'm glad that we have reached 200,000 out of the 582,564 people that we had planned to do. And indeed, the Department of Health has assured us that additional doses will be made available to us so that there will be no reason for us to stop, so that we continue until we finish our program. In the light of disruptions of schooling brought by COVID, we agree that even our schools, when we come back, we're looking at what are the implications of level 4, but also want to say to our matriculants, we have what we call the WOZA Matric Catch-up Program and the campaign, and it's viewed, for instance, it's on SABC1, on DSTV, Catch Up, on YouTube channels, on Open View, and all support that we can give to our learners. So we want them, please, that even when we go on break, it should not be break for them. It has programs not only for grade 12s, but education programs. But we also want to implore our parents, our guardians and caregivers to ensure that during recess, children continue to learn using the available resources. Doing so, we think will protect the gains that we've already made and achieved as a sector. We also encourage our learners to remain safe, not to gather in crowds, to apply hygienic practices at all times, and avoid activities that continue to expose our learners and our people to infection. So they should not go partying, bashing. If we cancel contact sport, they should not participate in those things that we said are normally infectious activities. So even during break, we appeal to them to keep safe and make sure that they follow all the protocols. On that note, Program Director Gary Walker.
Thank you very much, Minister. Thank you very much. Thank you very much. Colleagues, I want to take questions to engage, but I'm aware that Mr. Msanga, do you have some questions before we go to the media which is there?
Not yet, you can start with the colleagues.
Okay. Can we get the indication of question, colleagues? Okay, now you then introduce yourself. Thank you very much. Can you raise your voice? Can you raise your voice?
I'm saying, Minister, if you can clarify, when it comes to the learners going back to a traditional timetable, the primary school learners, has there been any discussions around that, whether that decision still stays? And 2 weeks ago, when we had your briefing at Victoria, you had stated that the department was adopting a differentiated approach. Now, with this new strand, are we going to be using that each province, each school will decide on a case-by-case basis whether they should be shutting down or not.
Okay, thank you very much.
Okay, Makala Mutile from SABC News. Minister, just on, because you have just elaborated that provinces, most of them are saying that they will be done by Friday. What will be happening to those who won't be able to get vaccinated? Say, for example, the teacher has just been vaccinated for flu, and by the time you have been completed with your vaccination, they have not been vaccinated. Is there a plan for that?
Okay. Can you then allow the minister to respond?
Yeah.
There are no other hands.
Yeah, on the question from the ENCA, yeah, we discussed that in the morning to say, of all the other plans we've put in place, what is going to happen on the 19th when we reopen? So we agree that we have to monitor the vaccine, the virus, get advised by the health department, but up to now, because we don't have evidence to say by the 19th there will be problems, we will still keep it as we had agreed. But we will not be irresponsible that if by the time we want to open and bring more learners, there are still difficulties. So we've agreed to monitor, which we do, monitor the situation weekly, and we'll take that decision close to time if we want to change. But for now, we're not changing any of the plans we have. We continue to plan as we were planning. We will see close to the time if indeed our plan is going to encounter problems. On the differentiated approach, it was meant when we did notice that we were confronted with increasing infections. Some schools were closing, some were not closing, and had agreed as a sector at that time to say, rather than shut the whole system, we rather have a case-by-case situation, so that if in Limpopo, out of the 4,000 schools, it's Marobatuta only which is infected, we close Marobatuta, we allow every schools all schools to proceed. But with the president's announcement that the sector has to shut, then we're shutting the entire sector, because it's the president and cabinet that took the country to level 4, and therefore we operate within the framework of the country of level 4, and therefore can't implement our own separate program as we had seen it before. On the question of the teachers who would not have been vaccinated by the time we close, the Department of Health is monitoring. We know exactly the teachers that have been infected by COVID, which will not be able to vaccinate, who are still on the, is it 30-day period?
90.
It's how many days that they have to wait?
It's 90 days.
90 days that they have to wait. So we know which teachers are those, and we will work out a special program. And we know the ones which are going to come within this period, who may come later. On the other hand, even those that had flu vaccines, we know who are those teachers who are on flu vaccines, and when are they going to come. And those will be part of the mopping up. And that's why the Free State is saying it will finish on Friday, but it will remain open just to mop up, and they know exactly where those people are to vaccinate them. But if because we don't expect too many. If by the time we reopen, we still find out that there's still some teachers who've not been vaccinated, we will arrange with health, because we're working with health to get them vaccinated. But we're saying any other person who has no reason, either flu, vaccine, or COVID-19, who will not have vaccinated this time, we want all of them to come now, because when we reopen in July, we don't want to be running a vaccination program. And that's what we're saying and communicating. Thank you.
Thank you. There's a follow-up question. Thank you.
But this one to the MEC of Health. In the past, you complained about, or rather, you were concerned with the reluctance to vaccinate. How is the province doing in that? And you also raised the concern of the numbers increasing, even of admissions in hospitals. Where are we as a province?
We have since in the past week, we have seen the numbers of the people that are admitted going down. In fact, the infections in Free State seem to be stabilizing. They are not going up anymore. But as for the uptake of the vaccine, indeed, when we get to the 60 years and older, we are still seeing fewer numbers than when we started. There's a bit of reluctance on the 60 years and older. But what the department has done, partnering with our university and also with the with other partners like Right to Care, we are using our community health care workers to go door to door and encourage our elderly people to register and vaccinate. We also agreed with our districts that we must start now going to the families, especially of those that can't walk to our vaccination sites, to register them within their home and give them vaccine in their own home. Because where we are seeing the low uptake is with the program of Pfizer of the 60 years and older. As for the teachers, they are really coming in good numbers and we are excited. That is why we were able to, when we look at how much they respond, the good numbers they come with, that by Friday we would indeed have vaccinated a great number that we are sure that we may finish by Friday. Yeah.
Thank you very much. There's also follow-up.
One more question, Minister. In terms of those teachers, once moving those, once vaccinate, who have comorbidities, are there still conversations around whether they need to be exposed to go back to school? I know last time you said that they don't have a choice anymore because the vaccines are being made available. Have you received any concern feedback yet with regards to that?
No, I've not received any consent this far, and I've not received any reaction to that. We also are aware of some of the people that we gave concessions who are gravely ill, so those are separate. But it will be those who had requested concessions because they have high blood pressure, not necessarily that they are ill, and we're saying after this opportunity they can't be given concessions. Because we've seen from health after its vaccination program has had their workers at work most of the time. They had very few infections, they had very few problems, and we don't anticipate that after we've had a vaccination program, we should still have people who chose not to. So we're not talking about people who are too ill to work. Those who choose not to vaccinate cannot choose not to come to work also, because now it will be a matter of choice. Yeah, so that's what we're saying. But I've not received any consent.
Okay, thank you very much, Minister. There's another question on WhatsApp, which around the National School Nutrition Program. The question is, will the minister issue a directive to the provinces on how to roll out the National School Nutrition Program during this period of research?
The provinces know. They're the ones who are running the school nutrition program. And they know what the law is saying, that we don't run school nutrition programs during holidays. So it's only run during school days. So if we take an early recess that we don't stop classes by next Wednesday, the provinces and the schools, which is what they have been doing since 2020, they'll continue to what they've been doing. So I don't have to give directive, I don't have to tell them how to do it. They've been doing it. So they'll continue doing what they've been doing.
Thank you very much. We will take the last round of questions. If there are no questions, I will maybe take back to the minister to close, and then this question will be closed.
I thank you, Program Director. I'm a guest of the MEC. You should have asked him to close. I'm his guest. I'm just coming here to really support his program. And I said to him, it's a courtesy visit. I knew all along that the Free State would just get it right the first time. And that's why I'm not surprised when they say by Friday they hope to finish, and they'll be mopping up next week. And it was just for me here to come and witness that. I had planned to go to another site. I'm told they're already finishing, which is very nice. So, which is what I've said in Gauteng, that whereas health had said to us it takes 15 minutes to vaccinate, we found that even the same thing with Limpopo, that, and even here, is that because the information is loaded, and because the health has organized a number of vaccinators for us, here I counted more than 12 vaccinators just for this center. So, which means and it takes a minute for a jab. So if they've gone through the whole screening, a person will take the maximum of 10 minutes here. So we're able to do what normally happens in 8 hours. Free State has perfected it. They do it in 4 hours. Now, I'm told one center, it's not because they've run out of vaccines, but the system is so efficient that they're finishing now. So with the vaccines coming, it means we can ramp up even faster, and we'll definitely be able to finish on schedule. And for that, I'm very grateful and appreciative to my colleagues from both health and also people in the sector, but also for the support that we've been getting from teachers. We're also very appreciative and grateful to the support we've been getting from our teacher unions, from our school governing bodies, but also from the management of our private schools and independent schools, that our aim is to make schools safer places. But more important, to protect our teachers. They are very important to us. They carry the system on their shoulders. And if we can protect them, it means we would have protected the sector. And I'm very happy that they're coming in their numbers, and want to encourage the doubting Toms to say, MEC is vaccinated, MEC is vaccinated, I've had my jab, there's no crisis. Okay. I can't tshwara ke hlooho, matsoho a bohloko, ha ke so develop any clots. So we really want teachers to make sure that they vaccinate. And ka nako re ba kopang ka yona, we don't want any vaccination programs after this period. When we reopen in July, if all systems go, we don't want to run a vaccination program after July. If there's any emergency, it will be those people who are gravely ill or those for good reasons who couldn't vaccinate. But if not, please vaccinate now. Now that we have the time, I hope that Thursday and Friday, when learners are not at schools, will even help us to ramp even faster, because then we don't have teachers looking after children. We can bring them in schools. We'll make sure that there's no problems in terms of breaking the protocols. There'll be social distancing. We'll manage the whole place according to the health protocols, but we want to use Thursday and Friday also to ramp up our vaccination program, to vaccinate as many people as possible, now that the Minister of Health has assured us that all the vaccines are available in the country. Thank you very much.
Thank you very much. Let me start with MEC before we go to MEC.
Okay. Let me take this opportunity once more to thank the Minister for the visit, and also thank the Department of Education for working together with us and ensuring that our program goes as planned. Let me say, when we vaccinate the teachers, we are working on that number that we are targeting of the herd immunity that we want to create in our province of 1.9 million people of the Free State. So when we vaccinate the educators and the people that work in the department, that number is going down. So we are really grateful for them for responding so positively, and the program is going on very well without any we don't have any glitches in all our districts, in all our 5 districts of Free State. We see that we are working very well with the Department of Education. Like MEC Motshekga said, it doesn't only the working well together is not just focused on the rolling out of the vaccine, but we also have the school health program, which we need to also work together on and make sure that our learners are healthy. Thank you.
Thank you so much, Dr. Ndaba. We also must maybe thank the media also for publicizing and encouraging our teachers to come and vaccinate. I think if you look at all the channels, there's been a lot of good coverage about the vaccination of teachers. But also, government has actually demonstrated that teachers are extremely important. And I think that over the years, there was a doubt that teachers are important, and I believe now everybody realizes that teachers are important. They interact with so many families every day through their children. In the province, as MEC says, that we are targeting 32,000, and we have now vaccinated almost 50% at that level. So we are doing very, very well. The vaccination is continuing in all the districts at the moment. It continues, and we believe that come this Friday, we shall have finished. The rate at which it's happening, Minister, actually forced us to offer our own school halls. And teachers are ready, they're more comfortable. They don't have to travel long distances to go to vaccinate. So I really want to thank you and everybody. And at least let's continue to demystify vaccination. Let's continue to tell people it is safe to vaccinate so that we can actually go back into normal world to go and fill up the stadiums and be happy as you watch at Euro 2020. They're all in the stadium watching, celebrating. So we want to go back to that level also as a country. Thank you very much.
Thank you very much, MEC. Colleagues, this brings us to the end of this media briefing. The media briefing is here. Thank you very much.
You know, when you come to us as the ministers, we encourage us to more and work hard.
No, we are ready. We want the idea.
Yeah.
Just to shake the hand.
Just to say,
You know, when we were preparing the I think they're connected.